Hello everybody, greetings to you all. I'm Dr. Ganesh, gastroenterologist, hepatologist and interventional endoscopist from Coimbatore SG Gastrocare, New Siddhapudur. Here I am today to discuss with you about a very important emerging gastrointestinal related disease which is increasing in number in alarming way in India. This problem was frequently seen in the Western population, but now we are facing a huge burden on Indian population itself. It's called as gastroesophageal reflux disease. We call it as a reflux because the acid from the stomach reflects upwards into the food pipe and causes damage to the food pipe, leading to heartburns and other symptoms which we normally encounter, like difficulty in swallowing, painful swallowing. All these factors can be a symptom of reflux related problem. The acid produced in the stomach escapes into the esophagus very easily because the valve which separating the food pipe and the stomach becomes very loose, and the acid reflux becomes a bigger phenomena and causes damage. So why should we be worried about this? Because the longer the damage, the longer the injury to the esophagus, the injury heals by narrowing and the food pipe gets narrowed, and also they can develop cancers in the food pipe over a long period of time with persistent acid reflux problems. So it is important that we need to identify this problem and approach the gastroenterologist and take appropriate measures. Especially we have a lot of medicines to suppress the acid, use some syrups to coat the acid produced injured area, and also by endoscopically we can stop the acid refluxing into the esophagus by various procedures like arms procedure and also clipping procedures which we can do, and also use endoscopy as a technique to open the blockages caused by the acid related damages, inject drugs to reduce the bleeding from the esophagus related injuries. So by endoscopic technique we can control the disease also and also diagnose the disease. Some people also have recurrent cough and also breathing difficulties, worsening of the asthma, sneezing, change of voice, throat burning, which it doesn't get relieved by medications. We know that the acid can travel up the esophagus into the throat and up to the sinus and cause all these problems getting worse, like sinusitis, exacerbation of asthma, and increasing the sinus related disorders. So change of voice, all these things as a part of the reflux disorder. So how to prevent these problems? You have to change your lifestyle, adjust your food, come to the traditional Indian food, don't use too much of coffee, tea, don't smoke, don't drink alcohol. All these things can loosen the valve and cause more reflux related problems. And also you need to give 3 hours gap between having food and going to the bed. So if you have food at 7 o'clock and go to bed at 10 o'clock, so there is ample time for the stomach contents to empty. Otherwise, the acid content starts refluxing back into the esophagus. So these are small tips which you can follow in the life to reduce the acid reflux and adjust your food habits. Avoid all the beverages, coffee, tea, non-vegetarian food, and also fast foods, and eat traditional vegetarian, South Indian or North Indian type of vegetarian foods in moderate quantities. Thank you.